Hi, I'm Steve Ardire, advisor to MI10 and to numerous software startups, including my own Signal Action AI. Today, the subject matter is going to be on why the state of mental health is worsening, especially for youth mental health. The typical approach today, with the pandemic has been video chat sessions with clinicians and psychologists and psychotherapists. But the problem with that today is therapists can only provide surface level advice at best. And that's not good enough. You've got to be able to go deeper to understand, some of the hidden nuances in terms of what's really manifesting the problems with anxiety and depression. I mean, when you look at the metrics of the since COVID, 57% of people today say they have greater anxiety. They're emotionally exhausted, and 40+% their mental health has declined. Self-help AI is really going to be the new trend. So this is really like in healthcare for detection, like in radiology. The combination of a physician with an AI is much better than just the physician alone or the AI alone. And the same thing holds true in the mental health space, which has pretty much been lagging the use cases in healthcare for diagnosis, precision medicine, genomics. So the good news is that there's some proof positives that are finally percolating in the mental health space, where researchers and companies, commercial companies, are using machine learning to more accurately identify patients that have a mix of symptoms. And by doing that, your prediction detection is enhanced, and that's a good thing in terms of teasing in, the components. The current practices today are not teasing in social and economic factors that drive behavioral health risks. So if you can combine the clinical with the behavioral and the environmental factors, AI can reveal a more complete picture of behavioral health risk. And it will go from just being a traditionally reactive process, where responding only when the patients admit they are struggling, but a lot of them don't. They disguise that. So with a success focused AI, you flip the model, and then you can better predict when and where and how the patients are struggling, and then empower them after the measurability, empower them to alleviate the distress and get them onto the path of betterment.